Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
And how that prevents or reduces the risk of heart attack or stroke, which is something that we've talked about before. And an interesting article on a young lady of 61 years of age who was in pretty good shape, but woke up one day and had pain in her right arm and indigestion. And because she was in relatively good shape, she decided that it wasn't anything to worry about. And in spite of recommendations from her husband to go to the urgent care center, she refused. And the next morning, she woke up and actually dropped dead. So the article was just emphasizing the fact that women demonstrate heart attacks differently from men often, and that when you have symptoms of pain in the right or left arm or neck, chest, neck or the jaw, that you should see a doctor as soon as possible. Go to the emergency room if you can't go to an urgent center or emergency room, and make sure you haven't had a heart attack. She thought she had indigestion, and in many ways, indigestion is a heart attack until proven otherwise. So that was an article that talked about, but also an article on how to save your marriage with mindfulness, and talked about how often married couples talk at each other, but actually don't often listen to each other, and get upset with each other for reasons that have nothing to do with each other, but have something to do with other issues. So talked about how important it is for us to listen to each other, and also to be mindful and respect each other's needs, and how many of the marital counseling issues really revolve around one being sensitive to the other. And so I thought that was interesting, very common sense, but something that is of merit to think about. And they also talked about the advantage of mindfulness and meditation in general. So those are just some interesting thoughts. Okay, John, you want to start showing the slides? We have more than you expected. Yeah, this is an interesting article on the Damar-Hamlin collapse. And we all know that now he's recovered. Not as sure about what caused the heart attack, what caused the cardiac arrest, because that's what it was. Okay. And one of the things that is clear is that they had rapid and effective intervention. And matter of fact, having a cardiac arrest in a football game is probably one of the fastest way to be resuscitated. And they did a good job of that there. And they also had a defibrillator as well, which
I see you now.
Which made a difference, because they had to do that twice in his case. And interesting that we talked about the defibrillator and the fact that Levi Watkins from Hopkins, a black cardiologist, was the one who actually started the external defibrillator and actually applied it to men and women. and that this has caused increased survival. And also now it is inserted to people who have heart disease who are subject to having fibrillation, because ventricular fibrillation is lethal. But defibrillator can restore the heart rhythm, which is important. So, and of course, this also talks about the importance of having echocardiograms and also EKGs, and that the echocardiogram will point out if you have hypertrophic cardiomyopathy, which of course has been a common cause of death of athletes, sudden deaths. So, and that's one of the reasons if you have hypertrophic heart disease, they do not allow you to be a professional performer because they've had too many deaths already. But the one thing that they do have at these sports events is people who are quite well versed in the art of CPR and resuscitation, and that's what saved his life. One of the things that that article also talked about is the fact that information was not released to the public, but I have a different opinion on that. I think your medical information is personal, and sharing too much of it is not only unwise but illegal. They have a HIPAA Act that actually results in you being sued or fined for releasing information about a patient's welfare without their permission. So it could be considered a HIPAA violation, although it happened publicly and you want to know the information. It's private information that really should not be shared unless the patient allows it. And of course, the patient is had a heart attack and is intubated, then that can't happen, and the next of kin might decide. But I thought the hospital did the right thing in terms of limiting the information that was shared, because that's up to the patient to so indicate whether they want it to be shared or not. Any additional thoughts or opinions about that?
I thought it was prudent that they had one of his associates to release the information rather than have the reporters just speculate on what was going on. They had a very close friend spoke, who's the spokesperson.
Right, and he spoke at appropriate times. He didn't even release every hour, so he spoke at appropriate intervals, which was great. And I agree with you, that was very thoughtful. A number of people criticized the NFL for taking so long to decide to cancel the game and other things. It's easy to say that in retrospect, but this is a once in a lifetime experience, and I think you might use it to decide how you're going to handle other things. But it's the first time it's happened, and so taking time to make the right decision and is important. Now they could use this as a model for how to address similar circumstances, hoping that it doesn't occur. But should it occur, being in a better condition to give updates appropriately. Now the other question is he going to play football again? What do you think?
Well, yesterday on the news, and I thought it was strange, I think it was the coach who said, we're going to leave it up to him. I would think he wouldn't be playing anytime soon. It was such a severe episode. So I said, maybe I heard it wrong. What does that mean? Next week?
No, it's up to him, meaning that he and his doctor should decide that, and not the coaches. I think that's what they mean. And because to me, it's identifying what caused the cardiac arrest. And after that, then it would be up to him to decide because his life is at stake. And one of the things is that this is his job. And so they want to leave that decision to him and not be pressuring him one way or the other. I think that's what they meant by that. That it's got to be his decision, not theirs.
Dr. Callender, I have a question on that. You talked about cardiac arrest, and you also talked about heart attack. If the end result for him is heart disease, then I would say definitely no.
Well, as you notice in the original, I agree with you, but as you know, in the original article, they thought it was a blow to the chest that may have done that. But if they find he has cardiac disease, then it's clear he should not be playing professional football anymore. But if it's a commodio mortis, which is a blow to the chest, then it's up to him to decide. I think just like with the quarterback on the, I think it's the Miami Dolphins, Tua Tagovailoa. He's had a concussion now on 2 or 3 occasions. I think he needs to find another profession because we've already seen too many people at the end of that concussion story with brain damage, and that results in nothing but suicide or killing others or killing themselves. So anyway, those are some thoughts. Any additional thoughts on it? What would you tell your son? Janice, what would you tell Chris if he was in that situation?
I would say don't play ball, but I'm a mama.
Well, that's what I want.
Yeah, I would say no. Ultimately, of course, it'd be up to him. But if it was a family decision or if he was to ask my opinion, no. And this was so scary. It was so sudden. And I guess it can happen to anyone. And he was truly blessed that he had the help immediately available. Otherwise, he may not be here today. So that played a big part in his recovery.
Absolutely. Another interesting observation was that how they called upon the Lord to help, and so much prayer. Right?
Oh yeah.
It was kind of refreshing to see that America once again was praying to God for help. We have become less of a godly country, and so it was very alarming and refreshing to see the number of prayers and vigils that were carried out in his behalf.
Of course, he has incentive to go.
Go ahead, Darryl.
He has incentive to return because he's about 2 years short of qualifying for an NFL pension.
Yeah. Well, he may also be short of living to qualify because you have to be at a certain age to get a pension, right? And the pension doesn't start until you're a certain age, right? I think something like.
I think it's a number of years that you're playing in the league.
Right. Then it allows you to qualify for it.
Right.
Right. But then after that, it still doesn't kick in until a certain age, I believe.
Oh, right.
So you got to live to be that age.
Mhm.
Yeah, the other thing is that they could allow him just to ride the bench until those 2 years are up.
Oh, really? Yeah, you think that, huh?
Yeah,
Well,
if your skills don't allow you to make the team, you're just off.
right. That's right. That's how.
But I wonder if the organization is able to make pension contributions in his behalf, even while he's off not playing.
I don't know the answer to
Yeah, NFL has, you know, their contracts are with the Players Association. When you make exceptions, you void your contract. Then everybody's eligible.
So it'll be interesting.
I had a question. Did they determine the exact cause of the cardiac arrest?
Well, they have not released that information.
Do you, from what you've seen, do you have any opinion about it?
No, because they haven't released any information on it. So it's because I think, as was mentioned, they did not say whether he had any, and that is, of course, privileged information
Mhm.
that he would have to release. But they did not say whether he had cardiac disease or did not have cardiac disease, and that would be the key finding. And that information was not released, so I don't know. I have no idea.
And they wouldn't have picked that up in the testing, you know,
They would have, but they have not released that information.
No. I mean, prior to this incident, you know, they have very rigorous physical requirements, you know, to play, you know,
Right.
professional.
Well, yeah, but sometimes they miss things. So, but you're right. They do have rigorous tests, echocardiogram, and so forth that is likely to identify if you have that. But these tests that they did afterwards would be the final determinant of that, and they have released no information at all, which is how it should be. It's up to him to release it if he wants it released.
What's the time frame? I've heard that, I've heard 3 minutes, I've heard 12 minutes for no loss of heart activity that you lose. Is the brain or the heart? If it's brain.
Yes, if you have cessation of flow to the brain for more than 15 minutes, it's dangerous, and 30 minutes is hopeless. 12 to 15 minutes is the time that they usually set.
I had a friend who was preparing for cardiac surgery, and certain surgeries you go through a series of tests, and her doctor found something in her heart. He said, you need to go see your doctor, your primary care, about what's going on with your heart. And apparently it was an issue, and they put her on some medication. And she said she didn't like the way it made her feel, or she didn't like the taste. She stopped taking it. And off and on, she was having episodes of difficulty breathing. And one day she couldn't breathe. She was with a family member. They rushed her to the hospital immediately, but by the time they got her to the hospital, they couldn't get her out the car. And of course, she had to get help to the car. And bottom line, it was something about those 12 minutes, and she didn't make it. But to me, that was just one of those cases of a senseless death. You got something going on with your heart, and because of medication, you just don't take it. And some of us just take life for granted.
Yeah.
Yeah.
Yeah. If you've been healthy all your life,
Yeah.
it's hard to become a chronic patient. Whereas if you had illness all your life, that becomes your normal. So good health and sometimes is a deterrent to people because they think they are going to be healthy all their lives. And so they make decisions that make it not possible for them to survive. Okay, any other comment? If not, we'll move on to the next one. This I thought was an interesting article because we all need inspiration. And these are 7 people who did things that were inspirational. First, they talk about Johnson and Johnson's, who actually made a core mission to help create a healthier world for everyone. Of course, they have billions of dollars. And this is one researcher whose personal loss inspired her career path. Her grandmother died of colon cancer, just like somebody else, and she decided to start a phase 3 clinical trial for melanoma, and over time that seemed to help a lot of people in the hematology area. Multiple myeloma is a disease of the bone marrow, which is far more common than you would think, and it's a consequence of this CAR T therapy that we talked about before in clinical trials. It turns out that this was an important part of changing the survival rates in multiple myeloma. So this may have, maybe in over decades, may result in the saving of many lives. So that's one inspiration. Going down, please. Second is, this is a mom who kid got a genetic disease. You go down, which is retinitis pigmentosa, which is commonly found in people who are Jewish, by the way. And they told her that there was nothing that could be done about it. And so she decided to also start clinical trials to help find a cure. Now they haven't found a cure; they're still studying it. But there's the expectation that maybe these clinical trials will lead the way to addressing what has been a cause of blindness, but has really been untreatable. So that with genetic testing and clinical trials, it's hopeful that they may find treatment for it. So here again, the mother did not accept no for an answer. And, then, of course, this is a physician who also helped clinical trial participation, particularly as it relates to people of color, and became a part of a group administering clinical trials. As you know, at first there were no women in clinical trials. And then subsequently, there were rarely people of color in clinical trials. And so a lot of work has been done recently to eliminate both of those issues, so that you can't do trials, clinical trials now without having women and without having people of color. And so this is a benefit of this helps everyone, because when you have trials that don't have people, don't have women, don't have people of color, then your ability to help people is very limited. So this is good for all mankind. Okay, the next one is multiple sclerosis is it's far more common than you might imagine. I know a number of people who have it. It's an autoimmune disease that involves the nerves and the brain and back. And it can be, can paralyze you, it can come and go. And there are a number of people who have it, who take medication now that is able to decrease the impact of this autoimmune disease. Sometimes steroids help, and sometimes there are monoclonal antibodies that they use to help. But a lot of this is because we had clinical trials to now find out what works with multiple sclerosis and what doesn't work. So if you've been associated with anybody with multiple sclerosis, it can affect in a variety of ways, from causing you to be paralyzed to causing you to be blind. So many different ways it can affect you. But we do now have therapies that can be successful in decreasing the impact of multiple sclerosis. This is a transgender woman who underwent gender affirming facial feminization surgery, which is something that we are encountering more and more these days. And this is part of the future as we talk about people who have different conditions. This also talks about the pronouns that people use for themselves. Bring up the issue of gender and sex. What gender are you and what sex are you, and what were you born with or without a penis or clitoris, and how have your hormones affected your identification of yourself. We see more and more of this now. Then, of course, TB is still a big killer, but this is a TB survivor who became a TB researcher and activist and advocate in Africa, where TB is still one of the big killers in the world. Not as lethal as malaria, but still a significant problem. And this is someone who, because of her disease, decided to do something about it, and our research has made a difference in exposure to TB. Going down the line. And then, of course, you notice that all of these people, inspiring people, were related to Johnson. And so the Syrian refugee crisis in Ukraine has caused people to be concerned about how people in Ukraine are getting their healthcare needs and other needs met. And so these volunteers have pitched in to help other humans in distress. It's nice for us to see that examples like these and the International Red Cross and Doctors Without Borders are groups that look out for humans in distress. And it's all about charity and love, which of course is the greatest gift of all. Okay, I just thought it'd be nice to talk about that. This is interesting about Gattaca. I think we mentioned this, somebody mentioned this last week, about technology, gene manipulation, genetic engineering, and how that film talks about genetic manipulation. Eugenics, which of course many feel is a curse, in which you decide that who should live, who should die, and who should be parents and who shouldn't be. And this, of course, is something that I guess, being of color, we have looked upon it as a negative thing, but it has potential that some feel could be used as positive. I think it's the beginning of the end. Any other comments from those who saw Gattaca who think of the positive aspects of this?
Yeah, I remember seeing it, and it was very, very scary to me that we would determine who could do what based on their genes. And everybody was gene tested. And, there's some real smart people who figure out ways to get around it. I remember that Gattaca, that's one of the genetic sequences of nucleotides. And, you know, Dr. Atto and I were both studying over the NIH at the same time that this came out. It was very, very scary. You
Yeah, yeah. The more we know, the more we have to understand the things we can do, but maybe we shouldn't do. And knowing the difference becomes critical. And of course, in this situation, just like eugenics before, where they made decisions, just like, of course, what Hitler did with the Jews was attempt at purifying the race. So some of these people who are the most evil have some of the greatest ideas of how to make things better, but instead of making things worse.
the other movie that I remember was The Boys in Brazil. They went and found some a DNA sample from Hitler and cloned, I think it was 9 copies of Adolf Hitler. If you if you can imagine that.
Yeah, one copy was too much. But that's yeah, you know, Luciferian practices ever present.
Speaking of technology,
Yeah, this is an interesting development that is an application of artificial intelligence that studies have demonstrated in England that the use of these scans and AI, artificial intelligence, has improved the survival of people from strokes, the triple time. Of course, that requires hospitals that have the ability to do thrombectomy as well, which is now being done. But of course, all this means that you have to get to the hospital right after you have the stroke. The sooner you do, the better, because you lose about a million brain cells every few minutes. And so this technology, while it works, requires that if you have any sign or symptom of a stroke, that you go to a place that can take care of you very quickly. And since strokes are more common in women, and since you have to have somebody around to see you when you have a stroke, this then makes us be even more cautious about having people living by themselves, because since the older you get, the more likely you are to have a stroke. And every minute you save is probably at least a million brain cells that are saved. So that's the application of this in England. Whether this will be used here in the United States sounds like it's desirable. Whether it will or not is another question. This is an article that we may not talk enough about obstructive sleep apnea, because it is a disease that causes hypertension and many other diseases. May be a cause of increased fatigue, and now we understand that it may be one of the causes of osteoporosis, a disease that affects people as they get older, and is thought to be related to especially in older people and women. And so this study demonstrated that if you had obstructive sleep apnea and didn't take care of it, that your likelihood of having osteoporosis would significantly increase. And I include it because it's important to understand that if you have obstructive sleep apnea and you snore, usually you need to have somebody in the room with you to know that you snore or not. That it needs to be treated. Now, of course, the PAP, the machines that they used were the commonest therapy, but now they're coming up with therapies that don't require these sleep apparatus. So it's important to make a diagnosis of it, which can be only done by monitoring you as you sleep and recording your oxygen level.
But Dr. Callender, I complain about my wife snoring, and I heard other people say, well, she should have a sleep study. Well, when I told her that, she said, well, you snore. So I went and had a sleep study, and I found that I had mild obstructive apnea. And eventually, like a year later, she went and had the sleep study. She had severe. And my younger of two also has severe sleep apnea, severe obstructive sleep apnea. And so I use CPAP every night. I'd be interested to see in the group how many, but with a show of hands, how many have CPAP, how many use CPAP, whatever. Show of hands. Anybody else?
Well, you have to have a partner who knows that you snore. And after that, you have to do something about it. Have a sleep test to find out whether it's mild or severe. And, did anybody else put their hand up?
No, but my son Chris had it last week. I don't know what the outcome was, so I have to check with him.
He had a sleep test.
Yeah.
What's the difference between mild and severe?
Mild means that your oxygen levels do not go down when you sleep. Whereas obstructive sleep apnea, your oxygen levels go down significantly. And as a consequence, you are tired most of the time. And it impacts you so much that it causes hypertension, it causes osteoporosis, and many other conditions that leave you fatigued. And it can be caused, as I think Darryl mentioned last week, that it can be caused by adenoids obstructing your airway, or morbid obesity can cause it. And if it's related to the upper airway, there are surgical corrections for it. But if it's related to something that cannot be surgically fixed, then the respiratory apparatus that they give you to sleep with. Does your wife use that?
Yeah, not enough, but yes, she has one, and she travels with it. That's another thing. They're allowing you to bring it on a plane now. Yeah, and yeah, it's a little uncomfortable at first, but when you get the good quality of sleep, when you don't wake up snoring, wake yourself up snoring, it's very effective.
They have a new thing that promises that you will not have to use those apparatus in the future to treat sleep apnea, but that remains to be seen. That's just a commercial. I haven't seen any research studies that demonstrate that is as good as the machine.
Is someone that has sleep apnea snore all the time or just occasional?
All the time.
Yeah. That's right.
Yeah, they snore. They snore almost all night. Yeah.
Oh,
That's what the obstructive sleep apnea is severe.
so someone who just snores maybe when they're really, really tired or something would not be considered. or you should.
Well, you can either sleep. The final test is whether, and if you have somebody who snores for 5 minutes, that's not the obstructive sleep apnea we're talking about. Talking about somebody who's they actually stop breathing. They actually stop breathing, and then they start breathing again, and that's the obstructive sleep apnea that it's a cause of sudden death as well, in addition to hypertension and the other things. It's something that is much more common in African Americans than it is in other ethnic groups. And it is thought to be one of the reasons why we have so much hypertension and other diseases.
Dr. Callender, does sleep apnea, is it in any way related to a person who may have a large heart?
No, not related to the heart at all. It's related to the upper airway, but not the heart. The heart is not associated. Any other comments or questions? But it's something we don't talk about too often, but it's something that affects us, the African American population, more than others, and so it's important for us to be aware of it. If your spouse tells you that you snore a lot and you stop breathing when you snore, then it's appropriate to get a sleep test. They can analyze your sleep and the oxygen levels and decide whether you have obstructive sleep apnea.
Dr. Callender, good morning again. I had a family friend that we complained about his snoring. And it seems like when he ate a large meal and went to bed at night, which we didn't agree with, that he would snore. And so we finally got him to go take a test. And so he stayed overnight to take the test. And when he went to take the test, he didn't snore at all.
So it shows that it was his unhealthy eating before he went to bed that was the problem, huh?
Yes.
That's an interesting story, yeah. But that's the absolute arbiter of whether you have it or not. The sleep test. They put you to sleep and they monitor you and your oxygen levels. That's an interesting story. We've talked about how to eat to live longer, and I think there's so many diets. The vegan diets, there's the vegetarian diets, the Mediterranean diet, the DASH diets, and all of these diets are all aimed at letting you live long and be healthy. And so this study followed this large number of people. And after that, they looked at the questionnaires, and of the 4 healthy styles, it looks like the ones that stressed vegetables, grains, Mediterranean diet seemed to be the one that worked out. Of course, they didn't seem they differentiated between the vegetarians and the vegans, because that's an interesting also group that they might have included, although they may consider that vegans who are vegetarians are lumped into them. Is that an appropriate lumping, Darryl, you think?
Yeah, vegans are vegetarian.
Right, but I mean, is it okay to lump them with the, or should they be dealt separately?
It doesn't really matter as long as people understand the difference.
Okay, all right. Well, anyway, they lumped them together, and they all demonstrated that they were we're the ones who had the benefit of living longer. Of course, one of the things to keep in mind is that it isn't the meat that's killing you. It's what we put in the meat that's killing us, and what we put in our chickens, and putting antibiotics and hormones and other things. That's what makes the processing of the food is what is an additional problem. The sugar and sodium and the antibiotics and the hormones are what really are the biggest problem, because God didn't put those things in those animals. We did.
Darryl, what is the difference between vegetarian and vegan?
Okay. Vegetarians are plant-based, but they will eat dairy products and honey. Vegans eat no dairy products and they don't eat honey. So anything that's, dairy product is an animal-based food, and so is honey. So anything that comes from an animal, vegans don't eat.
Okay.
Okay, this is a deviant study in many ways, because people have talked about the fact that artificial sweeteners in some species cause cancer. And so this is an article that's different, that says that artificial sweeteners do better in terms of giving you longevity than sugar. For example, this is what was found in mice, which is the first study, and that sucralose, aspartame, and ozone, which you find in diet sodas, were problematic. And this is one of the few studies that combined data from 17 randomized studies that says that substituting sugary drinks with Splenda and those other things actually reduces body weight. But what it also doesn't address, and this is this graphic that looks at it, and it doesn't show a significant change in the hemoglobin A1C, but it does show change in fasting glucose. Yeah. And so this is just one of the few studies that actually demonstrates that these artificial sweeteners are beneficial over sugar.
Good.
Well, I don't know.
I still use my Splenda, and I know we've talked against it, but
This study doesn't talk against it, but
yeah,
most other studies have.
right.
This study does not. That's interesting.
Mhm.
It's the only study that I've seen, but it combines a number of randomized studies to make its point. But
Yeah, I'm not a sugary drinker. I do like my coffee in the morning, and generally it's just a half cup. But if I put sugar in it, it tastes strange. But that pack of Splenda, it makes all the difference in the world. And I don't drink soda, so I said I'll drink my Splenda, use my Splenda.
well, okay, just to
This
give
makes
you
me feel better
information.
about it.
Give you the information, and you take it and do what you want with it.
Yeah.
Okay, all right. Any other comments? Will exercise save your life? That's something we talk about almost every week. And there's probably some people who hit that 150 minutes a week, and some who exceed it by much. But one of the problems is that this 30% reduction overall mortality rate is something that most Americans are not consistent with, and that's just the lower side of it. And this just shows the number of people who actually do 150 minutes more. How do you get people to exercise more? That's a good question. I don't know. Any thoughts? And whether you do it on the weekend or whether you do it during the week doesn't matter. But any thoughts about how you get more people to exercise? Since we all know it, it's beneficial.
You can pay.
Well, if
Do it together.
knowing that you live longer when you exercise isn't enough motivation, what is?
Doing things, exercising together helps sometimes.
Yeah,
Having a partner.
they,
Yeah.
Yeah.
Yes.
I think there's evidence that that's the case. Yeah.
Mhm.
Well, it's something that we know is beneficial, just as we know meditation is beneficial. But because you know it's beneficial doesn't mean that you're going to do it. But I think the more we educate about it, the better, the more likely we are to do it, I think. Any other thoughts of this in terms of how we can emphasizing mortality, if you think would do it, and cardiovascular death and cancer and all that you think would do it, but since so few people exercise, it seems that we ought to do more. Question is, what is that more?
When my husband lost his mother, we inherited her pooch. And I've always said when we lost our first dog that I would never ever get another dog, or that we would never ever get another dog. But that taught me never to say never. So we now have the pooch. But now I've fallen in love with her, and we walk every day. We have 20-minute walks every day, and I can really feel a difference in myself. And she's to the point now that we normally go out about 4:30, and she knows about what time 4:30 is, and she starts growling. So she is in tune to going out on her walks, even if I don't feel like it. So it's been an encouragement for me.
Well, that's an interesting point. In other words, getting a dog, because the dog will keep you healthy. That's an interesting tidbit. Yeah, yeah.
But what I found most interesting is she knows when it's time to go for a walk. She starts moaning and groaning.
Any other thoughts in terms of, so you give
I
somebody,
got a Christmas present, and a lot of these fit things are very complicated. And this one tells time and tracks the steps. And my granddaughter gave it to me, who's in college, back at college now. Grandma, how many steps did you do today? So because I know she's going to ask me, it gives me the incentive to step it up. And oftentimes with steps, it means just that, steps. You don't necessarily have to go out if the weather is bad. I mean, in your inside space, you can do steps. Don't have many so far. I think it's like 600 this morning, but it's early yet. So after our group, I'll go out and do a walk and try to get some extra steps in.
6,000 to 10,000 is what is recommended daily.
Yeah.
That's kind of how I started too. I had the tracker, and I just would make sure I did my, but I did it in the house basically.
Mm-hmm.
But I would, if I was at 9,050, I would keep on walking. I'd make sure I hit the 10,000.
That's been a big advantage for me also. And I have a tendency to run around the table in the breakfast room, and Reggie looks at me like I'm crazy and say, you've got to do better than this. So, but that tracker has really been a help.
Right. You get your steps in.
Yes,
Yeah.
getting my steps in. Yeah.
Any other thoughts? That was interesting.
Yes, Dr. Callender, for me, I was exercising with the wellness, the local wellness, community wellness center. And because they changed the plan, they no longer do exercise by Zoom. Then I had to find a backup plan. And so I went to YouTube. And so I found a program where this lady was doing Zumba for seniors for
Yeah.
45 minutes. And so now I'm not on anybody's schedule. I can do my exercise at 6 in the morning. And so that's more in line with my schedule because I'm an early bird. I don't have to wait on the group to exercise. I can now just exercise with myself and YouTube. So that has worked out great for me.
Great. Any other ideas? That's good to hear. Yeah.
I used to walk 6 to 8 miles a day, 3 times a week. But I had a little hip pain. So once the swimming pools opened back up full time, I've gone back to my swimming. And so I swim and snorkel like 40 laps 3 times a week, Monday, Wednesday, Friday. And I've actually lost a lot more weight swimming than I did walking. I think that's because swimming uses a lot more of your muscles than walking.
Yeah, swimming is a great exercise. Yeah. Any other? There's some very interesting ideas you shared with us. Any
Doctor, I know it has nothing to do with me exercising or the group exercising, but I see it's it's on the news more where the experts are recommending giving diet pills to children, obese children. And what kind of ledge are we walking off of that right now?
That's an interesting ledge. I know the problem with teen obesity is frightening, and the diseases that they get are frightening. So is the idea of giving them medication, but the question is which is the lesser of the two evils, and I guess time will tell. That's interesting. Scary though that we need to do that to deal with teen obesity in that fashion.
Right. Okay.
Okay, this is something that is new in terms of the 988 mental health suicide line, which is the equivalent to 911, but it's particularly important for people who are suicidal. And so this is recently launched thing. This is a interesting follow-up from people who are calling in, and it's interesting. In the Spanish culture, it's not cool to even talk about suicide, but that's true for many ethnic groups. And it's amazing. $1 billion in federal funds helped make it happen. And 2 million calls since it started. Wow. Amazing. There's one line dedicated to LGBT youth. That's interesting. I didn't know that they had specific lines. I know that it was there. But we all know that depression as well as other things contribute to suicide. And they even have a veterans crisis line. That's interesting. So, and of course, the incidence of suicide in veterans is far too high. Amazing. Well, let's hope that this helps. As we know, the Native American people have particularly had they been abused through the decades. We stole the country from them, so we owe them so much. Any thoughts about this 988 line?
Doc, there was a young rapper, singer, I think his name was Logic, came out, I think it was a couple of years ago, with a very big hit record that talked about suicide. And I think that was one of the reasons that they started this 988 line, because so many people related to it and could identify with the ideas that he was talking about. So, and I think that's one way to desensitize it, you know, to make it make people willing to talk about it, because I believe that a lot of people have these thoughts, but they're afraid to speak up about it.
The stigma, yeah, stigma is associated with so many things, and mental health is one of the most common areas that stigma is associated with. And suicide in that mental health issue is amazing. Any other comments about it? This is a group that is specifically for families of deceased COVID-19 patients. That's a large group, since 1 million people have died from COVID in the United States alone. And so this is a group, and they've done single subjects with the intervention with the group to talk about how they're surviving and what are the consequences of this group. And most of the studies indicated that it was very helpful, as you can imagine, because being able to talk about the frustration, the anxiety, all of the things that go along with losing a loved one, and then for them to die from COVID makes it especially problematic, especially when you couldn't get to see them, because they wouldn't even let you come to visit people with COVID. So, which created even more stress from the disease itself. But, so it's nice to see that this group therapy did help those people, as you would expect. As it is helpful for just about any other disease, to have somebody to share with you in terms of your grief and everything else. And so this is one way of addressing a multitude of mental health issues. And they documented this very well. And their group lasted 60 to 90 minutes. In this group, they had 43 families. And they looked at those that completed and those that didn't complete. Very small numbers, so can't make much of this because the numbers are so small, but it's the beginning of something anyway. And I think over time, when you have more numbers, you'll be able to really understand how beneficial it is, because it's clearly something that allows people to talk. And you allow people to talk and people listen. And I think that's what it's really all about. That's what sharing and loving is all about anyway. Probably one of the most important gifts you have is to have the gift of listening, be able to listen to others and then contribute based upon what they say. And the inability, insomnia, the inability to sleep after losses, is one of the commoner symptoms. I think my brother, when he lost his wife, he couldn't sleep for a month. And not sleeping for a day or two is problematic, but not sleeping for a month is disastrous. And that is not uncommon for people who are mourning, have difficulty sleeping. And so much so that some of them take sleeping pills, but the long term, that's not good either. But anyway. Any thoughts about this?
I fall in that category, and it's been 3 years for me, but my sleeping at night, it's sporadic. I can do 2 hours, 4 hours. Last night I did pretty good. I slept 6 hours, but it's not consistent. It's just the way it is. It's different. It's different.
Any other comments? I guess we all are grieving, we're losing people all the time. So
Mhm.
no other comment. Okay. The question is, what role does counseling, what role does group therapy play in ameliorating this? And over time, we'll see. This is interesting because this is the second time they had approval for an Alzheimer's disease treatment. The last one didn't do any good. This one, there's some evidence that this irreversible progressive brain disorder is slowed down. And because there was evidence in this study that 27% of the patients had a slowing down of the progression of disease. Didn't say cure, but said slowing down. None of the other diseases, none of the other medications have had an ability to do anything with the Alzheimer's. So this is the first drug which really has demonstrated some improvement, although 27% is not a lot, it's better than zero. And that's why they did an accelerated improvement in the mild cognitive, and the earlier you get this, probably the better, because at the late stage, it's probably too late. But if you make a diagnosis early and start treatment, it may be beneficial. Now, as with all treatments, there's side effects, and there are side effects of this treatment as well. And that's why you need a longer term study of this medication, but it's accelerated because no other therapy has been this effective. Any comments about this? If you have somebody with Alzheimer's, would you think about it?
Yeah. What are some of the side effects, or do they know?
One of the side effects that I read about was that they actually had some brain hemorrhages. That was one of the side effects. And so it was not without its own hazard.
It's a toss-up.
Yeah. Yeah. Now, this is something that probably doesn't surprise anybody, but should it be meditation instead of medication, or should it be both? That's the question. Can alleviating stress improve glycemic control? Yes. Certainly, stress worsens it. Steroids and other things, other epinephrine, norepinephrine, steroids, increases glucose production and is problematic. But that psychological interventions significantly reduced hemoglobin A1C. So it's suggested that mindfulness as well as meditation will reduce diabetes distress and improve glycemic control. So it's probably a good idea to use some of both rather than one or the other. Of course, yoga is a form of meditation as well that has been effective at reducing the blood sugar as well. But I think these are more effective when you have a hemoglobin A1C in the range of 7 and 8 rather than hemoglobin A1C of 12 or blood sugars well over 300. Tai Chi and yoga have been demonstrated to be helpful. And they've been randomized studies that demonstrated without question that these are helpful meditation efforts. So that I guess the conclusion is that it certainly is beneficial to have the meditation. Whether you should do one without the other is another question. I think it's clear that you can use both. I'm not sure that you should substitute one for the other, though. But I think you can do your own hemoglobin A1Cs and blood sugars and see.
They're saying that's good for people who are stressed and have diabetes.
Well, I think everybody's stressed. So, I mean,
My husband's not stressed.
he's not stressed.
He's not stressed.
Okay.
He's
Well,
not stressed.
okay. Well, they're just suggesting that meditation can be as important as medication, as medication.
Yeah.
And I'm suggesting that one or one without the other, it may be good, but I think one with the other may allow you to at least reduce the amount of medication and maybe get to the point that you can eliminate it, especially with type 2 diabetes, where not only is meditation important, but weight reduction is important. So it's food for thought for people who have type 2 diabetes. Type 1 diabetes is different, but for type 2 diabetes, it's apparent that the meditation can play a great role. Any comment about that? Or any differences of opinion? Best ways to treat cold. I think we talked a little bit about this last week as well. But I think they emphasize getting vaccinated, get your flu vaccine, get your COVID vaccine, get your pneumonia vaccine, get your booster update. Talk about Tylenol being a drug that you can use. And particularly if you on blood thinners or anything, aspirin is problematic. NSAIDs maybe as well. And these medications increase your blood pressure. And these vitamins helpful as well. And then, of course, being well hydrated is part of it as well. And then the importance of face masks coming more and more an issue. Hand sanitizers, humidifiers, and of course, staying well hydrated. And after 3 to 5 days, you get better and go out again. RSV, as we know, is still have no vaccine yet. Still working on it. But the thoughts are wash your hands, stay away from crowded spaces, wearing a mask, eating well, exercising, getting enough sleep. There's an article that talks about the triple endemic, that RSV, flu, and COVID. And this then, of course, is something that we know is going to be with us for the next 2 months. And so an ounce of prevention is worth a pound of cure, but the other items we mentioned are important. Now, immunity debt, to me, it's a theory that doesn't make much sense, but what they're saying is that because we haven't had these diseases in the last couple of years, because we've changed our behavioral practices, social distancing and maskings, that we aren't as able to fight off viruses as we could have been before, which I think doesn't make a whole lot of sense to me, but it's a theory. I think, me, anyway, I don't agree with it, but it's a theory nonetheless. That's what theories are for. We're proving or just, and of course, our immune system never stopped working anyways. That's why we're alive.
Dr. Callender, viruses were around millions of years before humans showed up on this planet. And their, survival rate is pretty much guaranteed based on the way that they act, physiologically, being able to mutate to take advantage of whatever circumstances show up. In spite of any vaccine, in spite of any treatments or anything, they are going to survive, I think. So I don't think this is going away in months or years, centuries. This is going on for the rest of the history of this planet. Viruses will probably be around after we're gone, I think.
Any other comments? Does that make sense? It makes that immunity debt hypothesis even more ludicrous. Why does there have to be a reason? Just is. One thing is clear that we need to do as much as we can to build up our immunity and be as healthy as we can, because these viruses are going to be with us, so we have to prepare our bodies as best we can.
They don't even mention the common cold anymore. That's a virus as well.
Well, the other articles mentioned it. This one doesn't. Yeah. But you're right. Yeah. Now, this I thought was very interesting, that they now have a malaria vaccine, which the #1 killer in the world was actually malaria, and so far, the vaccine was approved in 2021 with modest effects, and so we now have one that 48%, which isn't very high, but it's not as high as the COVID vaccine. And it's probably on the par with the flu vaccine. This is probably a high, 52%. And so they started a 3-injection and 2-part study. And one of the problems, the numbers are pretty small. But their goal was to get a 90% reduction. Whether they reach that or not, if they get close to it, that makes it remarkable. They get above 50%. If we get into 70%, that would be pretty remarkable. Have a vaccine that you could use when you go traveling to areas where malaria is endemic. Any thoughts about this, Dr. Atto? Any thoughts?
I got a comment that sickle cell, having the sickle cell trait provides malarial protection, but having sickle cell anemia does not.
Yeah, that's correct. Interesting. Interesting comment. This is interesting that the World Health Organization is back to wearing masks again, especially in long haul flights. The XBB variant is affecting now about more than close to 30% of cases in the United States. And so as you travel, it's suggesting long distance travel that you start wearing masks again. For those who've stopped wearing masks, some of us still wear masks. When I go to the basketball games, I don't see anyone else with a mask. Yeah, so they look at me strangely, but
I don't care. I don't care how they look at me. I'm gonna wear my mask, period.
hi, Perlene, how are you?
The grocery store as well, you know. I mean, I see 2 people with masks on and 50 people without masks.
Right, same thing. Yeah.
I'm with you, John.
Yeah,
Mask all the time.
I
Yeah.
agree.
Yes, I too. I
Mhm.
went into my kids had decided that the family should go to a birthday celebration for my son at a famous restaurant. I looked around. I mean, I know it was lots of people in that restaurant, but I was the only one with a mask.
It happens. Yeah,
Yeah, that's the way it is.
don't stop. Don't stop.
Well, you know, this is interesting. They came out with a price of $150 for the COVID vaccine. Now, the government is providing about 1.7 billion to fund development, and that's why they say $110 to $130 a dose. Once it becomes commercial, that may not be next year. I mean, may not be this year, but it's likely to be next year. 5 times the amount that the government paid.
Dr. Callender, on price hike in general, I noticed that with retail stores and other places that they are charging the same price, but less quantity.
Of what are you talking about?
For example, if you bought a box of let's say a box of
Cereal, it's anything. Cereal, for instance, it's almost doubled, but if you look at the packaging, it's a much narrow box. Might be the same size, but then if you read the quantity, the ounces or whatever it is, it's different. Everything's gone up. They were talking this morning about the price of eggs. It's almost triple. Let alone your utilities. Anybody get a gas bill recently for home heating? Mine went up $130 from 1 month to the next.
The
Everything's gone.
current bill
Yes.
$405 for gas.
Yeah,
Yes, because what I was thinking about was the dryer sheets. I used to buy 150 dryer sheets for $1. Of course, now it's $1.25. But now I go in and it's only 10 for $1.25.
Wow, what a difference.
Dryer sheets are toxic. There's an alternative. You can use balls. They look like tennis balls, but they're really made, I think, of lamb skin, and they're reusable. You can use them in your dryer. They're just as effective, but less toxic than dryer balls.
Well, the purpose
I mean,
of
than
my
dryer sheets.
but the purpose of my dryer sheets is that I used to get in my basement these little insects that look like spiders, but they're not spiders, and they have these long legs. And my daughter brought some dryer sheets home from college, and I noticed whenever she used the dryer sheets, the little insects disappeared. So
Well,
when
think
she
about it. What's up? Whatever's killing your insects is probably killing you too.
okay, but slow it down, little Darryl, slow it
so
down.
bad example, huh?
Let me finish. So when she left, I took the dryer sheets and placed it in sporadic in the areas of the basement. And now I have no long leg spiders, insects at all. And I can't use dryer sheets for myself because my body is so sensitive to them. And of course, based on what you said, the toxin. But for that purpose, I use them because I do not like insects.
This is an article that caused all the hospitals now to no longer do COVID testing for asymptomatic patients. So whereas before every surgery, whether you're symptomatic or not, you had to have a COVID test. The research has indicated that no longer is there a need to do COVID tests unless there's evidence of symptoms of COVID disease. Of course, this is great because it decreases the amount of money that's spent. And also it's time that's lost because of doing COVID tests on every surgical patient. So this is a dramatic turnaround, which is good for all hospitals. So when you go to have surgery now, you don't have to have a COVID test, whereas prior to September, if you had surgery, you had to have a COVID test before you had surgery. Well, as all of you know, that one of our Black physicians was killed, an orthopedic surgeon was killed because his patient was unhappy after spine surgery. Yeah, this doctor's a Black doctor, an orthopedic doctor. And just this article just talks about the stresses that we're all under because of the fact that healthcare personnel are in jeopardy. And because drugs seeking patients, I had one patient came in to kill me and one of my colleagues because his sexual potency was not what it should have been. And fortunately, he encountered psychiatrists who kept him from shooting us. But this is something that we as healthcare providers recognize as one of the concerns that we have, not only getting diseases from patients, but also being killed from patients or being damaged by patients. So healthcare providers have this concern. And we rarely ever talk about it, but it is something that you have to be aware of.
Doc, how long ago was that?
How long ago was what?
Where someone tried to hurt you and
Well, this doctor in Tulsa was last year, but me was about 20 years ago. I've only had two. I had one mental patient, well, one of my transplant patients got steroids and was paranoid and he threw something at me. And then this doctor, this other patient. But those are the only two instances in my career where I've had patients who tried to harm me.
That's how long a career? That's not many.
No, I have a career of 50 years, so there's two in 50 years. But all you need is one.
That's
Yeah.
right. One was too many.
Especially if they succeed.
All you
Yeah,
need
one
is
was
one.
too many.
Yeah, all you need is one. But
Yeah.
now I put this in here because I wondered what your thoughts are. You know, we have a shortage of nurses, and they're talking about dropping the passing rate for nurses taking the standard licensing exam because of the widespread nursing shortage. What do you think about that? Should we lower our standards because we need more nurses or not? What are your thoughts? I put this in there for us to get some thoughts from you relative to this. Do we still want to have the quality of nursing that we already have? Or are we willing to drop our passing rates just to have more nurses? What are your
No,
Absolutely
the
not.
teaching.
Don't lower
Why
the
would you want
standards.
someone less efficient, less trained? No, change the teaching method.
you remember the
Pay
nurse-
them more or.
Yeah.
you remember
Yeah,
Take some of the responsibility that's not patient related.
Yeah,
Away
I think
from
they need
nurses
more.
and give it to somebody else who is, and they can have a lower standard, but the nurse is actually treating you.
Yeah.
Right, right.
Yeah.
I totally agree. Because I
Paperwork
coach
and stuff
I
like
coach some nurses on some wellness plans, and as part of the consultation, I have to listen to them because I have to know the whole picture, and overstaffing them. But I think it's important, like we do with students. If you get a student in the 6th grade and he's on a 3rd grade reading level, you know you got to do some prerequisite support in there. So I just think that we need that nurses in any area of high standards like that,
Hi.
we need that
How are
prerequisite
you?
support.
You look good, Mark.
I feel better.
So I just think they need that prerequisite support.
Mhm.
Yeah, do you remember the nurse that put the wrong prescription
Yeah.
and ended up with the patient dying or getting real sick? So yeah, I think less is not going to work.
Dr. Atto, you had a comment?
Yes, yes. Very recently, Britain has, or UK has the same situation, a shortage of nurses. And then they gave out a quota from the 3rd world countries, how many nurses they could apply to come to London and then practice. I don't know if America will do the same thing, but of recent, I have noticed that a lot of nurses are coming from Nigeria and Cameroon and Ghana to US. They are working with MedStar. I don't know about other hospitals. But very recently, I've noticed an influx of nurses from these 3 countries. I don't know whether you all are aware of that.
No, but I think I agree with the general feeling that we shouldn't lower our standards. And I think one of the problems may well be that nurses are doing less patient stuff and more AI stuff. But I think we can't lower our standards. And if anything, we may need to modify our teaching as you have suggested. This is this is something I thought was surprising, that this plastic surgeon got a license suspended because she live streamed surgical procedures on TikTok. And the reason was that she engaged in dialogue while she was doing the surgery. And also there were problems during the surgery. And so she had been warned to protect patient privacy. But now, as a consequence of this, she's had her license suspended. What do you think about that? Patient privacy, the issue. Should the doctor be answering questions while she's doing the surgery? What are your thoughts about it?
Well, this article says that the surgery requires focus at all time on the patients, and if she's looking at a screen to answer questions, she's being distracted. So, absolutely, she should lose her license.
Any other comments? Dr. Atto? You're on Zoom. Okay, go ahead.
Yes. What was the question before the previous speaker?
The question was, what do you think about the surgeon losing her license because she live screened her surgery, and during the surgery, as Darryl said, she was distracted by questions. I think the prevailing thought is that you should have one focus during your operation. That's the patient.
Oh, yes. Definitely, he should be penalized. That doctor should be penalized somehow.
Any other comment on this? Okay, anyway, I just thought it'd be interesting. Now, this is something that is unusual, that she had 2 cancers, one HPV-related throat cancer and breast cancer, both in the early stages. Now, we realize HPV related throat cancer and breast cancer is unusual for 2 early cancers to occur at the same time. Yeah. And we usually think of HPV in men, but this is it's interesting that she made this public. I don't know why she did that. Yeah. So anyway, it's unusual to have two primary cancers at the same time. But anyway, this is something that she was willing to publicize. Any comment? You have a comment, Dr. Atto?
No, not really.
Okay. No. I put this one in here because I thought it was another way of bringing in something we talked about before. What do you think this anti-COVID secret weapon is? Before you read this article.
Exercise.
Yeah.
Are you patient?
Yeah, that's what it is. It's exercise.
Okay.
And then people who have physical activity have a decrease in hospitalizations and deaths, and that everybody should be exercising. Anyway, this is just something we talked about earlier, but I thought that the way they wrote this article up, it was, what is that secret weapon? Secret weapon is exercise, physical activity and exercise, which we have talked about ad nauseum. But anyway, nutrition, exercise, sleep, and whole body meditation. Hey, go ahead now. I think that's good. Now it's interesting. At the end, he talked fitness is no guarantee because people who are highly conditioned have COVID as well. But it's just that the more fit you are, the less likely you are to have the hospitalization and mortality. Now, there are studies that demonstrate that exercising while you have COVID is not that smart, that you should wait for about 7 to 14 days to resume exercise. And your body is the final arbiter of that. Any other comment about this article?
Yeah, my comment would be just comparing COVID mortality rates USA to Western Europe. And internet says that mortality rate was far higher in the United States than Western Europe. Major difference, Western Europe, people walk for all of their services. They walk to the grocery twice a day. They generally walk to work. In America, we use cars. Cars are killing us.
Okay. Now this is a kind of a paradoxical article because it says Paxlovid was hailed as a game changer. Well, it actually is a game changer, and a lot of this talk about rebound and side effects have turned out not to be deterrent to using this drug because it nearly 90 reduction in nearly 90% of the risk of severe COVID. And it has been effective when it's used. Rebound has turned out not to be a real problem. It does occur, but it has turned out not to be a real problem. People who have rebound still had effective treatment of COVID. And the monoclonal antibodies have been rescinded, so that the only treatment available is actually Paxlovid. In addition to which, it is now thought that Paxlovid may be good for long-term COVID, which it wasn't used for before. And so research is now being done to find out whether Paxlovid actually can prevent or treat long-term COVID. We don't know yet whether that is the case, but that's so the long and short of it is to say that Paxlovid has done what they expected it to do in spite of the rebound problem. The other problem with Paxlovid, though it is an issue, is that it interacts with many other drugs. And so this has been a problem, as well as makes some foods taste bitter or metallic. But it is effective and it does work.
Dr. Keller, I don't know if you remember, but when we had the group session on the 4th floor of the towers, I used to walk up the steps all the way to the 4th floor.
I remember.
I think elevators are killing us too, because it got to a point where I could make it to the 3rd stairwell and then I have to take a breather and then finish up. And then when I had to take a breather on the 2nd stairwell, oh, I might as well just use the elevator.
That's interesting. Yeah, I remember those days when you were taking the 4 flights. Yeah, so yeah. Well, That ends our